Hi everyone, hope everyone is having a great day. My name is Britt Fallon, I'm the beauty director at New Beauty Magazine, and today we are going live with Dr. Zedlitz. She is a board certified dermatologist out of the Baton Rouge, Louisiana area. She's a New Beauty partner and a fantastic resource for all things skin and skincare, and today we're talking about sun damage. So I'm going to go ahead and get her in here. I hope everyone is, it's middle of the week, short week, having a good one. Let me see if I can find Dr. Z here. There we go. Alrighty. Just waiting for her to connect. Hi.
Hey.
How are ya?
I'm great. How are you, Brittany?
I'm good. Oh, I love that Southern accent. So nice to hear. I'm from Virginia, so it's like so refreshing to hear a nice Southern accent every once in a while. How have you been?
Wonderful, wonderful. Just got back from the beach, but I practice sun protection, so I have a lot of tips for you.
I think you cut out for a second there. You said you just got back from the beach?
Yes, and I practice sun safety, so I have a lot of tips for you.
Good. So I just want to reintroduce you for everyone who's tuning in. So this is Dr. Ann Zedlitz. She is a board certified dermatologist in Baton Rouge, Louisiana, a New Beauty partner and a friend of ours, and just such a great resource for all the stories we work on about skincare and sun damage, and that's what we're talking about today. So I would love to hear if you could tell everybody a little bit about where you're located, how long you've been practicing, anything that we should know about you.
Sure. All right. Well, I love skin, so this is going to be fun. So I am in Baton Rouge, Louisiana, and I do practice cosmetic dermatology strictly. I have been doing that for 10 years. Prior to that, I was an emergency room physician, board certified. So I have kind of a unique background. So when I do procedures in the office, I'm able to alleviate pain. So that's good. And then I have done a lot of TV work in the area weekly for 5 years on the local news. And I've done a couple of spots on the doctor's TV show nationally talking about different skincare concerns. But right now I'm in Baton Rouge, Louisiana, private practice. I have 2 locations, one in Baton Rouge and one in Prairieville.
Nice. So I want to know how you've been doing with the whole, you said you're at the beach today, but I want to know how you've been doing with the COVID situation. Have you been doing telehealth? Are you reopened? How is that working for you?
Yeah. So we were actually closed for 6 weeks, at least 6 weeks. So we just recently reopened. And of course, we're following all the CDC guidelines, and we have masks. We have patients in their car, and then we go out to get them. We check their temperatures. They wear a mask. We bring them right into their room. And so there's no waiting in the waiting room. And of course, all of our staff, before we reopened, were tested for COVID. And then we all use the PPE protection guidelines also. So it's different. I don't know how long we will have to practice that way, but we'll be safe until we don't have to anymore.
Yeah. I mean, have you been feeling that the patients are kind of, uneasy about it, or
nope,
are they
not one bit. Maybe 5%. Everyone else is ready to get back, ready to have their procedures done. So no, quite the opposite.
That's great news.
Yeah.
So today we're talking about sun damage, and this is something that I think it's great for everybody to hear about prior to summer being
Absolutely.
in full swing, because we can talk about sunscreen all day long. We all know how important it is to wear sunscreen, but really learning about what the sun does to your skin on different levels and how it manifests on the surface, things like that. Like that's what I want to get into with you. And I think it's really important for people to know. And it is
great
Awareness Month, so it's a perfect time to talk about it.
Yeah.
So
that's great.
I'd love to start by, if you could tell us a little bit about how the sun impacts the skin directly. I think that would be a great place to start.
Sure. So the sun actually does a lot of, it does good things. It makes us feel good, right? Yeah. And I like a glow. I don't like to be ghost white. So I actually get a spray tan because I do think a little tan on your skin looks good. Yeah. But any tan is sun damage. So the sun actually interferes with our DNA and damages the DNA. And over time, that damage equals skin cancer. It equals pre-skin cancers. It wrinkles, uneven pigmentation. So all of these things together. And our cells can, to a point, repair the damage done to the DNA. But at some point, if you're out in the sun a lot, your cells are working 24/7 trying to repair that damage, and they can't keep up.
Yeah.
So that damage starts to build, and it shows in those areas that I talked about: wrinkles, the skin cancer, uneven pigmentation. And the sunlight stimulates these enzymes in our skin. They're called MMPs, matrix metalloproteinases. Oh, you've heard that before, huh? And what the sun does is it increases their activity. Well, what is their job? Their job is to break down collagen. Mm-hmm. We want our collagen.
Yeah.
In skin, well, in real estate, it's all about location, location, location. Well, in skin, it's all about collagen, collagen, collagen. We want to keep our collagen. We want to build new collagen. And that's what most of the procedures that we do are targeted at, building our collagen. But sunlight directly breaks down our collagen.
Yeah. So, I've heard that most of the sun damage you're going to incur throughout your life happens before age 20. Is that true?
No. But, I mean, that's good. Maybe it'll scare those teenagers into wearing sunscreen. I don't think so. But actually, there was a study done a few years ago, and I think it was the American Society of Photobiology. And they did a study, and it actually showed that we get about 23% of the total sun exposure before 18 years of age. And then we get about 10% per decade after that. So about 1% a year after that. So there's a lot of room for improvement. There's a lot of room to save that collagen in your skin. So don't give up just because you turn 20.
So what about sunburns, though? Because I feel like I've also heard that as well, that if you have bad sunburns as a kid, that can turn into skin cancer later.
Right. That's true. Those studies are true because it damages the DNA, right? Mm-hmm. And that DNA can be damaged only so much for your cells to keep up and repair. And your skin has to be healthy. You have to have good skin health. And everybody's DNA is different. And some people's DNA, it's better at repairing that damage. And the lighter skin you have, like me, I'm a redhead with pale skin. I don't have any sun protection capabilities. If I'm out for 5 minutes, I get burned. I have sun damage, and I've already had a couple of pre-skin cancers. I'm a setup because of all of that earlier exposure. It's cumulative.
Yeah.
So you're right.
So that kind of leads me to my next question, which would be, a lot of my husband, my family members, they all say, oh, well, I've heard that I'm allowed to get 15 minutes of sun exposure every day without sunscreen to get some vitamin D. So I would love to know what your thoughts are on that. And can you really do damage in 15 minutes?
Well, for me, yes.
Yeah.
I will burn if I don't have sun protection. So again, everybody's unique on what their tolerance is as far as how much sun they can undergo. And it's different depending on the time of day also. So it's we always say between 10 and noon, or when your shadows are short, you need to stay out of the sun. So you can go early in the day or later in the day. You could probably tolerate a little bit more sun. For me, I can't tolerate much. So, so vitamin D levels, very important. Supplements are very easy to take. That is there's a discussion. There is some controversy there. So I'll tell you what I believe. And what I believe is that I think that 10 to 15 minutes, a few times a week, 2 to 3 times a week, gives you all you need, right? And if for some reason you can't get that, supplementation is easy.
Okay.
Yeah.
So the 15-minute thing, if you can go out for 15 minutes and you don't burn, how much damage, if you don't see a physical burn, how much damage can you do in that time?
Well, again, it's your DNA.
Okay.
What is your DNA made up? Because there are people who you look at their skin and they look 10 years younger than they really are.
Right.
You look at other people and they look 10 years older. Is it because of the amount of sun exposure they've had, or have they had the same amount of sun exposure but their DNA is different? One DNA is better and more photoprotective. Maybe their nutritional intake is better, so those cells are able to repair themselves better. So there are many factors, but I do understand what you're getting at. I wish I could give you a more definitive answer.
Yeah, no, that makes perfect sense. I
Yeah.
think it's
Yeah.
it's just smart, I think, in general, to follow your rule, which is, a few days a week, minimal exposure.
Yes.
You know your skin better than anyone.
Mm-hmm.
So that makes sense. So I am very curious. I've been writing about skin cancer and sunscreen and sun safety for years, and I
Okay.
mean more than a decade. And I'm still
Okay.
curious as to how the sun damage manifests itself on the skin. Like, how long is it like growing under there? I mean, like we were saying earlier, if you get a sunburn when you're a kid and it comes out when you're an adult, how does that work?
Well, again, it's cumulative and the damage builds on itself, right? And skin cancers take years. It may take 20 years for skin cancer to develop. That's a long time.
Yeah.
You can't see it. But those cells are microscopic and they're dividing and they're growing underneath the surface. If you get freckles, if you have skin that is prone to get freckles, freckles is sun damage. Mm-hmm. So the more freckles you have, the more sun damage that's one thing we can see, right? Yeah. The other thing we can see is tanning, a lot of bronzing of the skin, that's sun damage. So those people, and if you have lighter skin, lighter eyes, it's going to take less sun exposure for you to have significant damage show up later in the form of skin cancers, pre-skin cancers, significant deep wrinkles in your skin, loss of collagen, loss of elastin. So, a lot of factors.
What if someone's asking a question? What if you have to be out in the sun, like a delivery driver for Amazon? How can sunscreen work successfully if applied while in the sun throughout the day?
Okay, so easy. Wear long sleeve shirts. You don't need sun. They have great gloves with the fingers cut out that are easy, lightweight, that's photoprotective, So a man may not care as much. A woman, you'll care more. If you're not now, you will care or wish you would have cared 10 or 20 years from now. So what I do, I carry sunscreen in my car door and I apply it to the back of my hand and then like this, so my palms never see the sunscreen that's not sticky. And then because if you're driving, the backs of your hands are directly exposed to the sun. Yeah. The other thing is they have great sunscreens these days that don't smell, don't burn your eyes, that are non-greasy. So find a good sunscreen, put it on, and as early, in the morning. If you're not sweating and wiping constantly, you're pretty good. If you are, reapply midday. The other thing is, hopefully those trucks have some UVA and UVB tint in their windshield. If not, it's pretty cheap to install. Certainly my car does, my home windows do, and also my work windows have that coverage.
Yeah. I mean, I think it's really interesting when you see, like, if you Google those images of people who studied like half the face and it's the driver's window side of the face.
Yes.
I mean, I'm starting to see sunspots on this area that I don't have on the other side, and it's because I was living in South Florida and driving for 5 years, and it's pretty remarkable what it does.
It is. You can see that, especially in mail carriers, and I have some pictures in my office for patients to see that because it is striking. It looks like a father and son or a mother and daughter, and it's just a left face, right face, and it really hits, it really drives home how important that sun exposure is. 90% of aging is from the sun. Well, I believe it when you see those pictures. Yeah. So hopefully just looking at, we should have one of those pictures to show right now. Huh?
Oh, I wish we did.
I think I'm going to have someone go get it.
Okay, yeah. Okay. And then also we can post on New Beauty Stories afterwards.
Okay, great.
So someone's asking, why do the hands age faster than the face? And you mentioned that if you are driving, they are, directly exposed.
Right.
What are some other reasons? And I know we're going to touch on it when we talk about treatments in a bit. We're going to touch on how to treat the hands, but what are some reasons why they age fast? Okay,
well, women, most of us wear makeup. So that's photoprotective. There's a lot of pigment and sun protective qualities in makeup. So that's probably the primary reason. For women who don't wear makeup, they probably age just fast. But again, if we're in our car, we're in the shadow mostly. Our faces are, but our hands aren't. They're on the steering wheel. So I have that picture. You want me to show it?
Yeah.
Let me see this.
Oh my gosh.
Yes. Can y'all see that? Look at that. That is one side of the face. That is not photoshopped. The left side. It is. It's remarkable. wear your sunscreen.
Yeah, that should be like on billboards. It should just have his face.
Exactly. We need to blow this up, please.
Wow. We should definitely, you know, if you could take a picture of that, we'll post it on New Beauty after.
Yeah, we can do that.
One thing that I've had done in the past, a couple times actually, is a Visia imaging of my face. It tells you your skin's age, shows you like the sunspots underneath the surface. And I was just wondering if this was something that, I know it's offered at dermatologist's office, is it something that all dermatologists utilize, and like, does it come as part of every new patient consultation?
Okay, so that varies by office.
Okay.
In my office, I have 2 of them because we use it a lot. I think it's vital to help educate patients, and that's our job as doctors. We need to educate the patient. Why is this important? And this is wonderful. I love doing this and talking with you and sharing the knowledge. And I actually have a Visia here. So that's what taught me. When I saw it, I'm a visual learner. When I saw the Visia and I could see the damage, now I have an example here so I can show the viewers. But Visia rates you in 8 different areas according to your skin type and your age in a percentile ranking. So 50% is average. Who wants to be average? Well, I was failing in most of my scores. Wow. Failing.
And your skin is perfection.
Well, it took 10 years.
Wow.
So I'll show you. This is a Visia. Okay. So there's 8 different parameters. And I think the UV one is right there at the bottom. See that percentage? What percentage?
Can you tell everybody what it is? It's basically 63. A device. It looks like a box, and you kind of put your face in it.
It's like a little photo booth, and you put your face in, and it takes different pictures of left, right, frontal views with different filters, different lighting, and the different lighting will show brown spots, ultraviolet damage. It'll show your pores, the amount of redness you have. Again, what's average for your age and your skin type? No one wants to be average. I like to get in the 90s now. I like to have an A. And then you can actually, it ranks you for your age. Like this is one of my employees, and her true skin age, she's 33. Let's see, you can see she's 33, but her true skin age was 27. So she was actually 6 years younger than her age.
Yeah.
That's after we had some treatments. So it's really neat.
Yeah, I think
it's a good tool.
Like you said, a lot of us are visual learners, and I think a lot of times like you said, you can't see it now, but 20 years from now you're going to see it. And if you get the Visia, it's very impactful, I think, for doctors to be able to say, this is what's coming if you don't take care of your skin. Right.
There's actually a little bar on there. You can scroll it, and it ages your skin, so you can see how your skin's going to age, and then you can roll it back. So for me, when I had mine done and I didn't like my scores, I took it home, put it on my nightstand, and it gave me that little extra incentive to put that cream on at night. Yeah. So I've had a lot of patients do that. And then we can repeat it after you've had some procedures done, or after you've used that cream for 3 months or so. And then we take another one, and you can compare them. And we can print out the comparisons, and you'll go like, well, wow, this stuff really does work.
So Tatiana, our features editor, who I know you know, she just wrote that, asked that question actually. So you already answered it. So thank you.
Okay, good.
Someone is asking, is it true 1 out of 5 will get skin cancer over 50?
I think that's probably, it depends again on the ethnicity of the patients, because it's certainly lower in Black patients or Indian patients than it is in white Anglo-Saxon people. So I think that varies. There are very common skin cancers like basal cell, and a lot of skin cancers go unnoticed for years, but that number sounds about right.
Wow.
Yeah.
So speaking of products, we were talking about sunscreens, which someone asked a question about. I think it was Tatiana actually asked if you could tell us if you have any favorite sunscreens.
Oh, yes.
Okay. And we'll start there.
Okay. So I like products that you like to put on your face, because if you have a great sunscreen, but for some reason you don't want to put it on your face, well, it doesn't matter, does it? It can be great in the bottle on the counter. It's not going to help you one bit. So the first thing I say is find something you like, whether it's something that is moisturizing because you have dry skin, whether it's something that has no oil in it because you have more acne-prone skin. something that has a tint in it that can take one step out of your morning routine, where your sunscreen is your makeup and sunscreen all in one. So I like combination products. I have one that has a little moisturizer in it and sunscreen. And then one of my favorite, actually it's one that I developed, this one is ZMD sunscreen, and it's a physical sunscreen. And this is good, and it has I call it spackling, but it helps with the pores. It fills in your pores.
Little blurring effect.
Yes. It has a primer in it with the sunscreen. So this is one, and it has a tint. So a lot of people, especially young people like this, people with acne prone skin, and teens and preteens, when you're just teaching them how to wear a sunscreen, or it's important, with the little tint, it makes them think they're wearing makeup. So this kind of helps them to get started. So that's one of my favorites.
Can you find that on your website?
Yes, you can find that, and we have, it's all over. It's all over my website.
Okay.
And in the Instagram also.
Okay.
Okay.
What's your website, just so everyone knows?
Yeah, zdermatology.com. And you hit the shop now link, and it's all there.
Okay.
So this is one of my favorite spray sunscreens. I took this to the beach with me. This is Elta. They make great products.
They do.
And this is actually a water resistant spray, and I actually tried it on my son one year. I said, let's see if this stuff really works. So I put it on him in the morning. He was like 10, and all day long he was at the beach. Never got burned. I didn't even reapply, but you really need to reapply when you come out of the water. So this is a great one. Love it.
Yeah.
I have one more I want to show you. This is one that I love for men, because men are picky. They're not going to do much. They're going to do 2 things, if that. Some of them will only do 1 thing. Well, if there's one thing that you can get them to do, get them to wear a sunscreen. This is my favorite for men. It's non-greasy, doesn't smell, doesn't burn their eyes. This is a perfect one.
Yeah.
So those are my favorite sunscreens.
And that's the clear, right? So that's great for all tones.
Yes. Great for acne skin, oily skin, but men really love it.
Yeah, that's awesome. So that my next product category for you is, I'd love to know, people are always asking me, what's the best dark spot corrector? And I want to know, maybe it's not just a product, but what ingredients, topical ingredients, do you recommend to your patients to use for dark spot?
Sure. That's the key. Let's write down the ingredients, people. So when you talk about brown spots, well, number 1, let's help prevent them. What's that? Sunscreen. Because if you're putting a product on at night to help lighten the brown spots, but you're still getting the sun exposure in the morning, well, you're kind of chasing your tail. So let's do both. Let's protect it in the morning, and then let's repair it at night, or reverse some of the brown discoloration. So we have prescription products, we have over-the-counter products, and we'll kind of go through all of those. So my favorite, because I like to get the job done, get it done quickly, and then you have just enjoy your clear skin, right? So I love hydroquinone products, and I like a higher concentration of hydroquinone. So a normal, they have over the counter, which is 2%. Well, that'll take forever, like maybe 10 years. So I don't recommend the over counter hydroquinone, but there are many products with that 2% in it. In a normal prescription product, there's 4% hydroquinone. I like it with 8% or 12%, because you get it done fast, and that's what we want. Give me the results, and then let me just do a better job protecting my skin. So I like products with hydroquinone in them. I actually
wait, can I interrupt you for a second?
Sure.
Can you talk about, though, because there are people who are going to say, well, hydroquinone is controversial, not everybody likes it. So can you tell us, why some people might not like hydroquinone and who shouldn't use it?
Sure. Well, you don't want to use it long term. I do it for 3 months until the bottle's empty. Then you take a break, you do something else. So that's the problem. I think people were using it high concentrations for long periods of time, and actually in darker skin tones to lighten everything. And there were some problems. So if you use it correctly in the shorter time period, I haven't seen or heard of any problems from anyone in the United States.
Awesome.
Yeah. So, but it's called ochronosis. You can have a permanent darkening of the skin if you use it for prolonged periods of time at high concentrations. So don't just order stuff over the internet. Make sure you're getting quality ingredients and someone is supervising how long you're using them. So we do breaks. And I also do, kojic acid is a wonderful ingredient for skin lightening. So I mix some kojic acid. You could go 1 to 3% 3% is the highest, and that's what I have with my hydroquinones. Again, I'm hitting it at multiple angles, at multiple steps of the pigment making process. So I like hydroquinones. I like kojic acid. I like glycolic acid is really good and underutilized, I think, for pigmentation.
Yeah.
Azelaic acid is another one. Azelaic acid is wonderful, wonderful, wonderful. There are trade names like Phoenicia. I think that's more 15%. Generic azelaic acid is 20%. I think Glytone has a product. I may have it here. I think this is 12%, and this actually has glycolic acid with it, if you can see that. So I like that product also.
What is that one called?
This one is called Enhanced Brightening Complex.
Okay.
Anyway.
Oh, yeah. They have some good stuff.
Glycone's good. Yeah. So they have, again, this is 12% azelaic acid, which is skin lightener, and then the glycolic acid. Great combination. The vitamin C. Vitamin C is great for pigmentation. Yeah. The trick with vitamin C is to stabilize it. So a lot of manufacturers don't stabilize it. Why? Because it's too expensive. Stabilizing the vitamin C is expensive. So if you're buying cheap vitamin C, you're wasting your money, and it's not going to help your skin. So so vitamin C's are expensive. You know, you're going to pay $100, maybe $150. But they're great, and you only need a little bit. So you can have one bottle, like this size bottle. It'll last for months, maybe 4-6 months, because you're only going to use 5 drops a day. 5 drops a day. Licorice extract. Okay, go ahead.
You always want to apply vitamin C in the morning for the antioxidant.
You definitely apply it in the morning. You can apply it at night. I have a moisturizer I use every night that has 10% vitamin C in it. So I like mine in the evening too. So I get a double dose, because I've had problems with pigmentation on my jawline before, but not anymore. Not with my sun protection, not with my vitamin C.
Oh my gosh, your skin is literally it's like porcelain.
Oh, thank you.
Beautiful. Yeah.
Thank
so
you.
we're all like taking notes from you.
Okay. Thanks. God, thank you.
And then, were there any more? Did I cut you off?
No, I don't think so. I think that's the best. That's the meat of it.
Okay. And what about I'm curious about spot treating dark spots versus applying these products all over the face.
Okay.
What are your preferences?
Okay. So if you have lighter skin with a lot of spots all over, you just put it all over, lighten everything. If you have darker skin with a few dark spots and you put it on all over, you're going to lighten everything. Yeah. And so those spots are still going to be the same contrast as your background skin. So you're going to see them just as much. So in that instance, then I would say you get a Q-tip and you just spot treat right on the dark spots. Or you use a laser to help. Or you use a hyperpigmentation where we just kind of burn it off very lightly.
Okay. And then Tatiana's asking, what about a melasma mustache? And I know melasma is its own beast, but what would you recommend for that? Okay, so number one, if you have melasma, you're going to be in a battle for a long time. So you better learn how to fight it. Mm-hmm. And number one step is sunscreen. But if you don't tint the windows of your car, a losing battle. You will never win, because you can be so good and put your sunscreen on and you can use these skin lighteners. And if you're in your car one day and you don't have sun protection on, you can get sun on your arm, and it increases a hormone called melanocyte stimulating hormone, and it will make you have make pigment here in your face just from getting sun on your arm. So you have to protect your whole body. I know it's so frustrating. Melasma is so frustrating for us as physicians treating it as well as the patient. So for me, I do a long education process for my melasma patients. Mm-hmm. Number one, sunscreen, physical sunscreen. Protect your arms, protect your legs. Because if your face is totally protected, but your arms and legs aren't, for that reason I told you, the MSH is going to go high, and you're going to make pigment here. And then get your car windows tinted. Wow. Yeah. Fascinating. Yeah, I've asked some dermatologists before, like, if you could create one product, any product, what would you create? And they're like, something that completely gets rid of melasma, because their patients would like go crazy, because it's such a hard thing to treat. So another thing I want to talk about is, if somebody kind of the treatment protocol for sun damage, what you recommend as a dermatologist. If somebody comes to you and they have sun damage, they're starting to see dark spots, sunspots, and they've already gone through a topical protocol and it didn't really do much, what is the next step for that kind of mild patient?
Okay. Mild pigment, you said?
Yeah, for somebody, like maybe it would be like IPL or a chemical peel, like what would be like more of the first step?
Okay. So it depends on their skin type. So lighter skin versus darker skin or somewhere in the middle, because that changes things. Peels are underutilized. People talk about lasers all the time. Yes, they're great. I love lasers. I have at least 20 lasers. I was head of the laser department at LSU for 5 years. I love lasers. Chemical peels can do just as much as lasers in almost any instance in the right hands. So chemical peels are underutilized and they give a beautiful result for both pigmentation and wrinkles. The only thing they don't get that lasers get are blood vessels, the reds, but otherwise they're excellent.
Okay. And what type of peel or how many do you need?
Okay, so usually my treatment protocol, you come in, you have some light pigmentation. I'm going to go over your daily routine. Make sure you're maximizing your daily routine because it takes about 12 weeks, 3 months for your skin cells to turn over. So you want to give that time. Well, if you're utilizing your daily products well, you're going to see a difference just with that. So maximizing your daily routine is key. So then we get into procedures. Well, what procedures? Well, budget. What's your budget? What can you afford? What about downtime? Can you afford any downtime? Right. Now we can because we're working from home, a lot of us. A lot of times you can't. So peels are great because usually you apply them and then day 3 you start peeling and you peel for another couple of days. Wonderful. So I like to tell my working people, you do it on Wednesday, you work Friday, you work Thursday, you look great, doesn't look like you had anything done. You start to peel a little bit on Friday and then you peel over the weekend, you're good to go on Monday. So I like doing peels midweek for those who work. Then I like IPLs. IPLs are wonderful. Some people can be too aggressive. Yeah. Some people want to be aggressive because they only want to do one treatment or they can only afford one treatment. Well, you have to know what you're doing. Otherwise, you can do it in steps. And usually I like to do 3 of them, 1 month apart for 3 months. And then you're going to be on your good daily routine and we're going to teach you. And then you just have to maintain. And maintaining usually entails 1 treatment every 6 to 12 months for the IPLs. BBLs. They're basically the same thing. I have both machines. I love them equally. So that's easy. We have chemical peels. Chemical peels can be anything from like a Jesner's peel with a little hydroquinone added to it. Jesner's is lactic acid, salicylic acid, resorcinol. Add some hydroquinone in there. They have other peels that have multiple ingredients in them. I really like they're called A peels, and they're awesome. TCAs and kojic acid and a lot of blends, salicylic acid. You can just have straight salicylic acid peel, which is really good. We have a hyperpigmentation peel. Again, that we throw in some kojic acid and some hydroquinone. So you can mix peels, you can mix acids. The key is consistency. So if you're going to do, usually it's going to be a series of 3, whatever you do, because you're making up for damage. And usually it's going to be 3, and then you're going to maintain. So I say maintenance, you need to do something for your skin every 3 to 4 months.
Okay. So what can you do a chemical peel on your hands? Oh,
yes. On your whole body. I've done it everywhere. Face, neck, chest, hands.
I've heard of people doing it on like their back for like acne. And, whatever. But yeah, I mean, I never really thought to do it. I've done at-home peels on my hands, but I've never would have thought of going to a doctor and having it, or an esthetician and having it peel.
Usually it's an extension of peels that we do on the upper extremity. So we're doing your arm for wrinkles or pigmentation. We'll go ahead and extend it down onto the hands. I do CO2 laser. It's a really significant laser. It's the most aggressive laser you can do for wrinkles and aging. And I do it on the hands all the time. It's beautiful. So yeah, don't forget about your hands.
So, and I think that's a good tip too. So something that I always tell people when they ask me for beauty tips is, when I apply my nightly skincare, I put it on the back of my hand first, and then I apply it to my face. Obviously, I make sure I wash my hands first, but that is like a built-in way to get a skin care
That's right.
on your hands. So that, but anyway, I'm just curious about, you said lasers. So would lasers be the next step? Would you go through these first, or would you kind of, if you see someone with sun damage that's worse, would you start with a heavy duty laser? Like, how do you decide?
Okay. So again, I briefly touched on it. Downtime, budget, skin type. So if you can afford the downtime and you have the budget, well, let's do the Mac Daddy. Let's do the top of the line and get it all done in one fell swoop. But that's 2 weeks downtime, and that's, $6,000. Not everyone can afford that. Or you don't have the downtime, you have the lighter skin, you can afford a more aggressive peel. We can do a series of aggressive peels probably for under $1,000. That's a big difference, right? So those are some of the things I look at, and I just ask the patient, so how's your work schedule? What's your downtime? And some patients are like, oh no, I can't have any downtime. I don't want any redness. I don't want any swelling. I'm like, well, we can't do anything. We're going to maximize your home routine. Yeah. And you can do what you can do.
So you mentioned CO2 lasers. What brand names of lasers are the best for sun damage that you offer or you recommend?
Okay. So for sun damage, so again, we can talk from pigmentation all the way up to deep wrinkles. Mm-hmm. There's a lot of lasers in between. And I have all of them, or most of them. So some of the smaller lasers, well, IPL, which is, so laser is an acronym. It's light amplification by stimulated emission of radiation. Woo-hoo, big words. But it's basically one wavelength of light, all running parallel, all the peaks and valleys are in line. And it's in the wavelength determines what pigment in your skin it hits. So what do we want to target with our laser? Do we want to target the blood vessels? Do we want to target the pigment? Do we want to target water, which helps with wrinkles? So the two big lasers, erbium and CO2. CO2 is the biggest. It does the most damage. You get the best results. And I love it. And I have two different CO2 lasers. Luminous does a great one, and that is the ultimate gold standard, and that's the Ultra Pulse. Mm-hmm. And there's one that's a little bit weaker that I love to do on bodies and necks, and that's by Candela, the core laser, fractionated. Most CO2s are fractionated now, where only a portion of the skin surface is treated, so the downtime isn't as much as long. So that's CO2. Then you have erbium. Erbium targets water too. In those lasers that target water, we're targeting wrinkles primarily. Okay. And usually we want to get around the eyes, right? This delicate eye skin. Chemical peels are harder to get close to the eyes. So that's a big difference too. So if we want to get close to the eyes, when I do those lasers, I put in eye shields and I go right up to that lash line. It is beautiful. It's almost like an eraser. You can watch those wrinkles go away. So erbium and CO2, they do that. So we come down a little bit, and Fraxel. Have you heard of Fraxel?
Yeah.
So that's 1540 nanometers wavelength. So CO2 is 10,600. Then erbium is 2940. And then we have 1540. That's Fraxel, that wavelength. Love that laser because really not very much downtime. So working women, we can do it on a Friday, and we're red and swollen over the weekend. I look like a Cabbage Patch doll when I get it done, but only for 2 days, and I'm good. So Monday you can come back to work with makeup on, and that's great for wrinkles. It's great for acne scoring. It's great for pores. Wonderful. That's one of the ones I like to use as a maintenance laser. So every 3 to 4 months, you want to do something to your skin. That's a great one to do. Then we have IPLs. What are some other lasers? Oh, well, we have other technologies such as sublatives, which is microneedling with radio frequency. Great technology, great technology. Great for pores, great for acne scoring, great for wrinkles. And you can kind of dial up, really with any of these lasers, but you can dial up how intense a treatment you want. And again, we ask the patients, how much downtime can you take? I want it all. Or, well, really, let's just try it, see how my skin reacts. So you know, we tailor it to the patient.
Mm-hmm.
So that's a great one. And we can treat here around the eyes, not quite as close, but we can treat on the upper eyelid with that too. Sublative, I think that's trademarked by Candela. They have a great machine, and I love that. I've had it for 5, 6, 7 years. And I have 4 of those machines because they're working all the time. Women love that machine. They're always coming back. That's their maintenance machine. It may be my favorite machine in terms of the most bang for your buck with the least amount of downtime. So that's a good one. That's the microneedling radiofrequency
Okay.
by Candela.
Okay.
What are some of my other favorites? Oh, well, one of my newest one is also by Candela. It's called Profound.
Yeah.
Yeah, it's awesome.
That's
It
the Mac.
goes,
That's the Mac Daddy.
yeah, you know what? I think it is. It is the best thing other than having surgery to
Mm-hmm.
tighten your skin. You can do it all over: face, neck, arms, thighs, knees, above the knees. Women, anybody have wrinkles above the knees? It's
Yeah.
wonderful, wonderful. And it has 2 different hand pieces. So you can do deeper cellulite treatment with a deeper hand piece, or you can do more dermal treatment and get the wrinkles in the skin tightening, especially here on the jawline.
Mm-hmm.
There is some significant downtime with that because of the bruising, and you have some swelling. So you can do an IPL the next day to help with the bruising, and it's gone in half the time. But usually that's about a week. It's not that you feel bad. It's just you have some bruising.
Yeah.
So
Can you
I
tell,
love that procedure.
can you tell everyone a little bit more about what it is exactly in terms of like the microneedles,
Mhm.
how they go deeper than the average, which is why it's so powerful?
Not only does it go deeper, so they have, I think for the dermal, they have 5 tips, pairs of needles that go into the skin surface, and they're delivered at the dermal layer where the fibroblasts are, because all of these machines were delivering heat. Why? Because we're rebuilding collagen. It's all about the collagen. Remember, skin is collagen, collagen, collagen. Real estate is location, location, location. We want collagen. So the pins go into the skin, and each pair will deliver the heat in between those needles. And it delivers the heat for an extended period of time for 3 seconds at 67 degrees Celsius. That's hot. Heat stimulates collagen. So if you think about it, 1001, 1002, 1003, it's delivering heat in between those 5 pairs of needles. And it takes a long time. I have a patient here today who's been here all day long, but she's
Wow.
doing multiple areas with cellulite, and then she's doing the skin tightening. So the cellulite pairs go deeper, and the fat. So they're treating the fat, and they're heating up the skin a little bit, not as much as the dermal, but it helps with the cellulite the most.
Mm-hmm.
You can actually hear the fat cooking when you do that procedure. It pops, crackles.
Oh my God.
It's so strange, and it's really so rewarding at the same time, because you can actually like, wow, it's just doing something. So.
And can you do Profound with a topical anesthetic?
I tried it and it was not comfortable.
Okay.
So we don't.
Okay.
We do a little topical first, but then we do some injections.
Okay.
Mm-hmm.
So yeah, I figured that's a pretty powerful.
We give a little medicine by mouth too. We make you pretty comfortable.
Okay.
I'm a wimp. I don't like pain, so I try
Yeah.
to keep my patients pain free.
Me either.
Yeah.
So someone in Undefined Beauty is asking, does your laser work for African American skin? So are there any lasers that you mentioned that wouldn't work?
Absolutely. There's some great ones. So one of the ones I mentioned, well, 2 of the ones I mentioned. One is the 1540, the Fraxel.
Mm-hmm.
Wonderful. It doesn't see pigment. It sees water. So it's wonderful for darker skin types. And it helps with pores. It helps, gives your skin a glow. And it stimulates your collagen because it's delivering heat. So that's one, 1540 or Fraxel. The other one is the Sublative, the microneedling with radiofrequency. It's wonderful for darker skin types. And there's another one too, Ulthera, which is great for the eyes. I love Ulthera for around the eyes. It helps raise the eyebrow. I do mine every year to keep my eyebrows lifted. Helps with the jawline too, the neck, laxity, and it doesn't see pigment either. So Ulthera is great. There are a lot of great choices.
I mean, I think people also need to realize that sun damage is not just spots and wrinkles, it's sagging skin.
Oh.
It's that breakdown of collagen and elastin, like you said. And so all of these tightening treatments and these lasers that you're mentioning and the microneedling, they're really like boosting the firmness and the plumpness of your skin, right?
Right. Well, yes. You know what's sad is I see it younger and younger now because of the tanning beds. The tanning beds are so prevalent for so long. I'm hoping that's changing a little bit, and I don't know if it is. I'm seeing it in sororities and high school kids. And if you use it a significant amount of time, you don't even have to tell me. I can see it when you come in. And you may be in your mid to late 20s. Your skin is in your mid to late 30s. It's 10 years older due to the damage. So we have a lot to make up for. So yeah, your skin looked tan and you looked good for that day. But down the road, you got to think down the road. So if you can, get that spray tan.
Yeah.
Yeah.
I can't believe anybody is using a tanning bed in 2020. I mean, I really can't, especially because they have self tanners now that smell like watermelon and
yes, they used to be terrible. I couldn't be in the same room with someone who was using a self tanner. But you're right, they have evolved. They're better, just like the sunscreens. Right. The sunscreens used to be terrible, greasy, burned your eyes. Who would want to put that on their face? Right. Not anymore. They're elegant. Same thing with self tanners. So definitely agree.
Yeah. Well, I think, I saw a couple of questions earlier in the chat about collagen peptides, and I wasn't planning on going there, but since we're talking about collagen so much, what are your thoughts on collagen peptides for helping with, I wouldn't say sun damage, that feels extreme to me, but just the skin from the inside out?
I'm not a big fan, and I think I've said that before. I think the topically it's too big of a molecule to get through your skin, so you're kind of wasting your money. So do procedures that are proven, topical ingredients that are proven that we know that can penetrate the skin. We want things that can penetrate the skin, and if the molecule's too big, it's not going to do it. It's not going to. It's it's great marketing. I'm not so sure about the end result in your skin.
Yeah. No. Well, thank you for that. I appreciate the honesty.
Yeah.
So I feel like we really covered it. Is there anything else that you would like to mention about sun damage or anything you're working on right now or any trends you've been seeing?
I'm sorry, would you say that last part?
Oh, I just said anything you're working on or any trends you've been seeing or anything that relates to sun damage that I may have left out that you find important to tell your patients. And
well, I want to encourage women. We're our own worst enemy. We're our own worst critic. And I'm constantly, all day long, trying to point out the positives and point out that no one's looking at yourself as harshly as you are. So love what you see. And if you want to improve a little bit, there's some things we can do to improve it. But if someone gives you a compliment, accept it and say thank you. Learn how to accept a compliment, because I just fight it all day long, and I'm going to keep telling you until you learn how to say thank you. And that's my biggest, because I grew up and I didn't have great skin, and so I have a soft spot in my heart for those who are trying to improve their skin, and so that's my biggest message I want to get across.
Yeah. I love that, because as women, when someone gives us a compliment, we do tend to say, oh, but, and then we put in a little negative, or we slight ourselves, we shortchange ourselves. And so you're so right about that. Yeah.
I agree.
Well, thank you so much. This has been so
It's already over?
I know.
Okay.
No, I feel like we could just chat all day. But I want anybody who's watching that wants a copy of the magazine and you can't get to a store, just shoot us a DM. This is the spring issue. We can send you a complimentary digital version of the issue, and you can find Dr. Z's profile in the issue as well. And I just want to say I'm so glad that you're well and you're reopening and giving patients all of the love, and we'll be spreading the sun safety message with you. So thanks for today. And,
thank you for having me. I love teaching and helping, so I appreciate it.
Of course. And thanks everyone for tuning in. We'll be back on tomorrow. Have a good night. Bye, Dr. Z.
Bye.